Hello, everyone. Welcome to this insightful interview session. This is Riddhi Prabha. We have the privilege of having with us Dr. Wong Cheong Ing, a distinguished senior consultant, medical oncology from Mount Elizabeth Novena Hospital, Parkway Cancer Center. We also have with us one of our patients, Ms. Nuzhat Tarannum, marketing professional, a cancer survivor diagnosed with hormone-positive stage 2B breast cancer. Thank you, Dr. Wong. Ms. Nuzhat, thank you so much for being with us today.
Thank you for the invitation to be here and to thank Nizat to be here with us here today as well.
Yes, thank you so much for being with us. Let's start with Ms. Nuzhat Tarannum first. Can you share with us how you first discovered your diagnosis and how that led you to seek treatment in Singapore?
Well, thank you for this opportunity to share my story. I'm Nuzhat, 44-year-old marketing expert, and I'm a breast cancer survivor. So my cancer was hormone positive, stage 2B breast cancer, and I was diagnosed in April 2022. So I did my chemotherapy, radiotherapy, mastectomy, and I have ongoing hormone therapy treatment. So I'm really excited to be with Dr. Wong. She's the person who helped me win my battle against.
Thank you so much, Ms. Nuzhat. Now, Dr. Wong, your dedication to Ms. Nuzhat's care is truly commendable. Could you share or elaborate on the treatment plan that you developed and what were the obstacles that you might have faced or anything like that?
First of all, I'd like to commend Nuzhat, for coming here today. Very brave. And also, and also want to commend her journey. She's very brave to, go through all the treatment for breast cancer. So when I first saw Nuzhat in April, she came to Singapore and, there was a lot of uncertainties, as to what needs to be done. And we have a lot of, we needed to do some tests, a lot of scans, to confirm, and we in fact needed to biopsy to make sure that everything is in order. We need to find out, what was the most appropriate treatment for her. So that is the first obstacle, because we need to be sure about what we're dealing with, okay, and what this cancer is stimulated by. So we did a biopsy. We found out, what was the most appropriate treatment for her. And we decided that she needed chemotherapy first before surgery. So we proceeded with the chemotherapy first. She had that. It wasn't easy. She did part of the treatment in Singapore, part in Bangladesh, and I'm glad that I could collaborate with the doctors here in Bangladesh, to finish her chemotherapy. Following which she went to Singapore again for the surgery, which again, she was very brave. She went through the mastectomy. And then following this, she's well now. She's on hormone treatment, and look at her. She's pretty brave.
Yeah,
yeah.
Ms. Nuzhat, how did this journey and the assistance of Mount Elizabeth Bangladesh office help you throughout this whole journey? If you elaborate.
So, let me share a little bit of my diagnosis. So, when I first felt an unusual lump in 2021 August, so I did a biopsy and some tests to confirm whether it's got cancer or not. So then at that time it was found out that it was a benign cyst. So the doctors advised there is no follow-up required. So after a few months, I felt the cyst is growing, and then again I went to see another surgeon and did another biopsy and ultrasound. So at that time, it was confirmed positive for cancer. So immediately we reached out to Mr. Mushrikul Rahman Amit, who is the CEO of Parkway Health in Bangladesh. So he took care of everything we needed, starting from our doctor appointments, visa, tickets, every logistical support, whatever we needed at that time. And because of him, we got to, it suggested Dr. Wong to us. And immediately we, in
within 7 days after I received my report on 20th April, we went to Singapore on 26th April 2022. So it was done really quickly, and we are very thankful that my treatment started really.
Dr. Wong, Nuzat speak highly of your compassionate approach. Can you share with us how you tailored your support to meet Nuzat's emotional needs during the whole process?
Yeah, so I mean, cancer is a very scary diagnosis for everyone, and when people hear the word cancer, they always think that this is actually like maybe a death sentence. But I like to just reach out and tell everybody that actually cancer is not a death sentence. Okay, in Nuzat's case, especially when she came to us, we did scans, we did biopsies. We found out actually this cancer is actually still very early stage, and it's definitely still very, very curable. So I think every woman, every patient we need to individualize our treatment, to tailor the most appropriate treatment. There is a journey that we walk with every woman from the start of diagnosis, breaking bad news, telling them the treatment they have to go through. And while they are going through the treatment, we have to support them, because chemotherapy is not easy. The side effects are not easy to tolerate, but we're going to have to make sure that, they continue the treatment, finish it up with minimal side effects, okay? And while doing that, we support them physically and emotionally. And then following this, we still walk this journey with them. She's still under bipolar. She comes, every 6 months, to Singapore for scans, to see the surgeon, to see myself. And, we are going to walk this journey together. I always tell my patients that we're going to grow all together. Yeah. So I think, if they are like, patient, a friend, a sister, so that's how we look after each and every one of our patients.
So as you mentioned about the follow-up, after the diagnosis and after the treatment is over, some of the patients, in case if they do not follow up, I think that might have an impact. Am I correct? So you think the follow-up is very important?
Yes, definitely. I think after every when they finish treatment, we need to make sure that they come for regular scans, mammograms, ultrasounds, to make sure there's no recurrence, and also to make sure that they tolerate the treatment. And I also like to take this opportunity to tell all women that before the cancer diagnosis, screening is very, very important. And I always use every opportunity that I have in this setting to make sure that all women go for screening. So for us, the guidelines, the guidelines for screening is at 14 years old, all women should go for a mammogram every year. And if the mammogram is normal, you can do it every 2 years after 50 years. On top of that, you also have to do your self-breast examination. That's again very important from age 20 onwards. And you do it usually about 7 days after your period, when the breast is the softest. So the earlier the breast cancer is diagnosed, the higher the chance of cure.
Okay, thank you so much. Thank you, Dr. Wong. Ms. Nuzat, can you tell us about your vision and how you plan to support breast cancer awareness and turn your journey into force for a change?
So looking forward, I want to turn my painful journey into something positive and meaningful. I have started raising awareness on breast cancer through my foundation, Tishcan. So I organize pre-love fair to raise my fund and to promote sustainability and encourage responsible shopping. And I collect the fund, and then I support patients, and we have a group of survivors. We do mental well-being healing activities with them, and I try to help patients who are in need through my fund. And I think in future, if there is anything from my own experience and my journey, I can help others, and if I can make a difference in their lives. So that's how I see myself.
Wonderful. Thank you, Ms. Nuzat. And we actually are making a very big change in the society at large in Bangladesh, because I think this social awareness is also very important. Like Dr. Wong mentioned about the screening, which is also important for female individuals in Bangladesh at this moment. Would you recommend Singapore or Parkway Cancer Center? How would you recommend to be?
I think Parkway has been with us for like more than 15 years now. For our other family members, we have reached out to Amit Bhai and Parkway Health, and they have always made our journey the most difficult journey we had. They made it easier for us. You know, when you think about cancer and when you first find out, it's like overwhelming with so many information, and you don't know what to do and you feel lost. So at a time like that, I think Parkway and Amit Bhai really helped us go through it and make everything like however, in whichever way they could support us. And it really helped us a lot. So,
and this really also is going to help everyone because of the social awareness that you're going to create, and you're already doing it very, very well. And thank you so much for sharing your inspiring story with us. And thank you for being with us today. Dr. Wong, thank you for coming to our program today. And thank you for sharing all your experience and knowledge, and your compassionate and dedication has led a high standard for healthcare professionals everywhere.
Thank you very much. Yeah. So thank you for this opportunity. And it's really good to see Dr. Wong in our country, because every time I meet her in Singapore, so meeting her in Dhaka, it's really something very good.
Thank you all for being with us today. We hope to see you again. And we also would recommend Parkway Cancer Center Bangladesh office, Mount Elizabeth Bangladesh office. In order to have any kind of queries or any questions, you can of course come to the office. Thank you so much.